Welcome back, AP Psychers. In today's video, we are going to continue the series that overviews each of the color-coded columns in the back of the class. Today we are going to overview the yellow color-coded column, Humanism, or the humanist approach to psychology. We were first introduced to humanism in Unit 4 when discussing personality, and then later on in Unit 7 when we got to clinical psychology and specifically the therapeutic techniques. Now, I know therapy has been removed from the AP exam, but I still have that column up here to reference because I think understanding the therapeutic techniques that are based on humanism gives you a good overall understanding of the humanist approach. Humanists always focus on one key word, which is growth, which is really more specifically personal growth, which is a way of asking, are you improving every day? Are you progressing socially? Are you progressing at work, educationally? Are you constantly, every single day, progressing towards what you wish to be as an individual, or are you stuck somewhere along the way? The theory or the theorist that we most often associate with humanism is a gentleman by the name of Abraham Maslow. That was a key psychologist back from Unit 4. He is responsible for what's called Maslow's hierarchy of needs. We looked at this visual back in Unit 4, but you notice these 5 separate columns, or these 5 separate rows, starting with physiological, safety, love and belonging, esteem, and then self-actualization. According to Maslow, everyone strives to reach the very top, self-actualization. Not many people actually get there, but everyone strives to reach self-actualization, which is when you become what you wish to be. For some, that might be a successful lawyer. For others, that might be a loving and caring parent. What you wish to be in life can vary depending on the individual, but that's the point of self-actualization. And humanists like Maslow and others really emphasize the idea that we are constantly striving to reach the very top of this hierarchy. However, along the way we need to satisfy each of the various levels. The very bottom one are innate things like food and water, things that if you are suddenly lacking, it doesn't matter how far up you got, you all of a sudden need to deal with. Assuming you have food and water and other basic physiological needs, you can then worry about safety. That's not necessarily just physical safety. That also could just mean things like having work, having income. If you don't have a job or you're not sure where your next paycheck's coming from, you might have access to food or water, but you really are stuck in that safety arena. The next level is what we call love and belonging. That's both intimate relationships, but also close friends and family. The fourth level is what we call esteem, which is things like praise at work, achievements at work, accomplishments, things along those lines, recognition and awards. Some students can confuse the esteem and love and belonging because they see the word esteem and they often associate it with self-esteem. It's a little bit more than just individual self-esteem. It is more things like achievements and awards. And some students sometimes flip the esteem and the love and belonging rows. Make sure you don't do that, and the best way of thinking about it is, if you go from the bottom to the top, if you don't have friends and family, if you don't have love and belonging, it doesn't really matter how people view you. It doesn't really matter what you accomplish if you haven't satisfied love and belonging. The very top to this is, again, self-actualization, when you become what you wish to be. That's what Maslow emphasized, and that's why the hierarchy of needs is the key theory underneath the humanist therapy, or under the humanist theory. Humanists always question personal growth. What are you doing to strive to reach the top? Are you stuck anywhere along the way? And there are other therapists or other names that fit this category. A gentleman by the name of Carl Rogers is responsible for what's called the client-centered therapy. If you remember back in Unit 7, we talked about this form of therapy that used active listening. When you try to show empathy, when you try to get into the shoes of your client. In the client-centered therapy, and specifically with active listening, you might remember some of those techniques where you don't butt in, you do a lot of head nodding, a lot of rephrasing, a lot of reflecting back into the patient or into your client, and seeing whether or not they can sort of carry on the conversation and have that moment of insight on their own. That's client-centered therapy. That won't appear on the AP exam, but if you understand how positive and how striving to grow that type of theory really is, or that type of therapy really is, you'll understand the broader picture as to why it's classified as humanist. That type of therapy really is, let's try and work on striving to grow, getting you back on track, allowing you to push towards the top of the hierarchy of needs, without butting in like some cognitive therapists might, or like trying to analyze the unconscious like Freud and a psychoanalyst might. So although Rogers and client-centered therapy might not appear on the AP exam, it is beneficial to understand them because it would then give you a better and more broad understanding of humanism in general.